47-year-old male who smokes a pack a day. John has symptoms of bronchitis, including a persistent productive cough, shortness of breath, chest tightness, and fatigue. His cough has lasted for more than 3 months in the last 2 years. The doctor recently diagnosed John with chronic bronchitis. John has a follow-up appointment at the clinic to find out what that means.
Hi John, my name's Gladys. I'll be your nurse today. How are you doing?
Well, hello Gladys. I've recently been diagnosed with bronchitis.
Well John, let me explain to you the pathway of air as it travels through the respiratory system. Air enters through your mouth and nose and goes down into your trachea, splits at the left and right bronchus. It moves into the bronchi, which branches into the bronchioles, which travels to the alveoli. This is the site of gas exchange, where oxygen is diffused into the bloodstream and carbon dioxide is removed. The gas exchange is essential for maintenance of respiratory homeostasis. This is a normal bronchi. Bronchi are airways lined with smooth muscle and contain mucus and cilia. This smooth muscle is controlled by the autonomic nervous system, contracting and relaxing to regulate the airflow. Now I will explain the mucus and cilia, which are features of the lungs to protect it from microorganisms and other foreign invaders. Mucus is produced in 2 areas. The first area is the outermost layer of the trachea, called the mucosa, which is shown here. Mucosa is made up of pseudostratified epithelium cells, which are these cells here, and contain goblet cells, which are these green cells here. Underneath the mucosal layer is the submucosal layer, which is made up of connective tissue containing seromucous glands. The mucus glands secrete mucus onto the trachea and bronchial walls, which foreign invaders and microorganisms are trapped in. Cilia are hair-like projections of the trachea and bronchi that sweep mucus up and out of the lungs. These are the cilia shown here. The mucus is then expelled through a cough or sneeze.
Okay, so I totally understand the normal anatomy of my lungs, but what is bronchitis?
Well, John, I'll get the doctor to give you more information.
Hi John, my name is Dr. Healer. And I hear you have some questions.
Okay, doc, so what caused this? Give it to me straight. I want to know.
Well, smoking is the main cause, so you might want to quit that. But other risk factors include long-term exposure to irritants such as chemical fumes, air pollution, and dust. But let me tell you how bronchitis works. Bronchitis is an inflammation of the bronchial lining. Here we have the inflammation process. Inhaled irritants, such as smoke, interact with airway nerve fibers, which release neuropeptides such as tachykinin peptides. These peptides not only mediate inflammation, but also cause smooth muscle constriction and stimulate mucus production. With inflammation, the arterioles dilate, causing heat and redness, and they cause an increase in capillary permeability, which results in pain and swelling. This diagram shows how the tachykinin peptides alter the function of the bronchi. Here we can see the inflammation, excess mucus production, and increased number of mucus glands. This is an up-close diagram. Here we see the increased number of goblet cells through the process called hyperplasia. Hyperplasia is excess cell division and growth of the mucus-producing goblet cells. Because of the constant irritation, more mucus is produced and collected in the alveoli, which become overburdened and collapse. This further impairs gas exchange, causing an imbalance in respiratory homeostasis. Due to the impaired function of the gas exchange in the alveoli, excessive CO2 is retained and hydrogen ions accumulate, leading to a decrease in pH. This is called respiratory acidosis. This diagram also shows the decreased number of cilia, which are destroyed by irritants such as smoke, as you can see here. This causes mucus to accumulate in the bronchioles. This is why you're experiencing that excessive cough, as you try to get the mucus out of your lungs. Irritation from the constant coughing causes hypertrophy of the smooth muscle. Hypertrophy is an increase in the size of the cells caused by an increased permeability of the cell membrane, resulting in fluid moving from the ECF to the ICF. And that's pretty much how it works.
Alright, so in summary, bronchitis is the inflammation and overproduction of mucus within the bronchus, and it accumulates in the bronchioles. The key concepts, touching on the cell membranes, when they're irritated, they become more permeable, allow more fluid to move from the ECF to the ICF, and that causes the cells to grow in size. In regards to proteins, irritants interact with the protein receptors, and as an immune response, they stimulate the inflammation process. And finally, homeostasis. With excessive inflammation and production of mucus, gas exchange is impaired. That causes excessive CO2 to build up in the lungs, and that causes the blood pH to decrease, making it acidic, and that's called respiratory acidosis.